The following educational video was created in collaboration with the Faculty of Biomedical Engineering of the Czech Technical University in Prague and the First Surgical Clinic of the General University Hospital. An electrocardiogram, abbreviated as ECG, is a record of the temporal changes in electrical potential caused by cardiac activity and is a standard non-invasive method for examining the electrical function of the myocardium. The electrical signal spreads from the myocardium quite easily in all directions throughout the body without being significantly weakened. This allows us to record it with relatively large amplitude in practically any part of the body surface. The origin and course of the signal. The impulse spreads from the sinoatrial node through the internodal atrial connections to the atrial septum near the tricuspid valve, where the atrioventricular AV node is located. The AV node is the only conductive point through which the electrical signal can pass from the atria to the ventricles. Usually the area separating the atria from the ventricles is electrically isolated under normal conditions except for the AV node. The AV node transmits the impulse to the His bundle and further into the Purkinje fibers throughout both ventricles. By stimulating the surrounding muscle cells, contraction occurs. After the impulse and contraction, the cells relax until the next impulse. This cycle repeats continuously. Electrode placement. The placement of electrodes is very important because it allows for the correct reading of the resulting ECG curve, considering the location of the heart as a whole and of individual heart sections. 4 electrodes placed on the limbs are used for measurement. The exact location is not critical, but the color and corresponding limb must be followed. Left hand, yellow left leg, green right hand, red right leg, black. This is the grounding. Limb and chest electrodes. They measure changes in potential between 2 electrodes. The first lead is formed between the electrodes R on the right hand and L on the left hand. The second lead is formed between the electrodes R on the right hand and F on the left leg. The third lead is formed between the electrodes L on the left hand and F on the left leg. These are marked on the ECG record with Roman numerals 1, 2, and the 3. Goldberg leads. There are 3 unipolar augmented limb leads, AVR, AVL, and AVF. They measure changes in potential between the electrode and the center of the opposite side of the Einthoven triangle. Unipolar chest leads of Vilsnov. We will place the leads as follows. V1, 4th intercostal space, parasternal right. V2, 4th intercostal space on the left. V3, in the middle between V2 and V4. V4, 5th intercostal space in the midclavicular line. In men, it is placed just below the nipple. V5, 5th intercostal space in the left axillary line. V6, 5th intercostal space in the left mid-axillary line. Each chest lead on the electrocardiogram corresponds to a specific anatomical location on the chest and records the electrical activity of the heart in the region beneath it. The precise placement of the chest leads allows the interpretation of the ECG and identification of which parts of the heart are the source of various electrophysiological abnormalities, which helps in the diagnosis and treatment of heart diseases. We will do this practically as follows. First, we palpate the first intercostal space below the clavicle. Then the fingers move along the edge of the sternum until we count the fourth intercostal space. We divide the clavicle approximately in half, which gives us the mid-clavicular line. We then place the fourth lead at the intersection of this line, and the fifth intercostal space, which in men is located just below the nipple. In women, it is variable. The third lead is placed on the line connecting the second and fourth leads. The fifth lead goes in the mid-axillary line at the fifth intercostal space. The sixth lead goes in the mid-axillary line at the fifth intercostal space. The ECG recording will then show the leads numbered from 1 to 6. All 10 leads together form the 12-lead ECG. Correct placement of the electrodes. The patient must not touch any metal parts of the bed. The patient's limbs must not be crossed. We begin with the limb leads. All leads must be properly moistened before being applied. Summary of ECG. The ECG records the electrical activity of the heart and detects any disturbances. It demonstrates acute or past damage to the heart muscle, especially myocardial infarction. May uncover issues with electrolyte distribution. It detects disorders of the heart's conduction system and the development of blocks. It is also used as a screening tool for ischemic heart disease during stress tests. The ECG is most commonly used to diagnose chest pain, shortness of breath, dizziness, and the sensation of heart palpitations. It can also reveal enlargement of individual heart chambers,